Our patients and followers make possible our practice, and I thank them very much for it. This video is the result of many combined efforts, as well as our foreign patient suggestions regarding the most appropriate information to share with our future patients. Fortunately, we have a great deal of experience with foreign patients, and we know that you have special needs. What are the needs that we are talking about? We know that your life is not here. Your most important responsibilities are not here in Guadalajara. Your most important responsibilities, your family, your job, your friends, and so on, are in another city, in another country. So we have a limited time frame to stay here during your postal recovery, and we must make sure that everything is in order with you and that you are in the most appropriate conditions to go back home with your wounds completely closed, with no drains and no stitches. Here are some important pre-op care suggestions that we must follow in order to avoid any surgical and post-op complications, as well as they will help you to work with your surgeon as a team member in order to have the best possible version of your future you. Number one, you have to establish some form of connection with your future surgeon. Okay, what kind of connection I suggest you to establish with your future surgeon? You can start with an email message, with a cell phone message, with a cell phone call, a video chat, a video consultation, or you can go directly to your doctor's office to have your personal consultation. Once this first connection is established, you must talk about your diagnosis. What is your need? What is something that is stealing your sleep? Okay, what is your particular need? Once you share this particular information with your future surgeon, this person may help you to agree with the best possible procedure to have your new you. Okay, what we need to talk about is about your past medical history. You need to share about your previous diseases, your previous condition, if you're under medical treatment, and what is that kind of treatment, if you're taking any medication, the name of the drug, as well as the doses and the periodicity. All this information is very important. You need to agree with your doctor about your special needs, and to let him or her know about your body or your face condition, so we can have an agree of the most appropriate treatment for you. Once you have your diagnosis and once you agree on the procedure, there are some important pre-op care suggestions that you should follow. Okay, number one, if you suffer from any disease, any metabolic or any chronic disease such as diabetes, hypertension, thyroid disease, and so on, this disease must be adequately controlled. Okay, an aesthetic surgery can be done in any patient that has this kind of diseases, if and only if your disease or this disease is controlled. Number two, you need to avoid all these particular elements that elicit an allergic process. Okay, if you suffer from a particular allergy, you need to avoid these elements, so you are not under an active allergic reaction once you schedule your surgical procedure. Okay, number three, you need to avoid smoking as well as heavy drinking for at least 2 to 3 weeks before your procedure. Smoking is a very important issue here because a lot of people smoke. Okay, and some of our patients have been heavy smokers. There is a very special need here. Why? Because the cigarette contains nicotine, and nicotine elicits a vasoconstrictor effect, so the vessel becomes smaller. Smaller vessels tend to have less circulation, and less circulation equals to or is equivalent to less oxygen and less food to the cells. If the cells do not receive enough oxygen and do not receive enough nutrients, the regenerative process or the wound healing process is not very effective, and the scarring process might be affected. So it is advisable to stop the smoking for at least 2 to 3 weeks before your surgery. Our heavy smoker patients have dealt with this issue, and there are a lot of success cases with previous heavy smokers. So if they could do it, so why don't you? Okay, remember always to share all your past medical history and to be completely honest about your current medical status. Okay, so we can avoid any undesirable medicine reaction during or after your surgical procedure. You need to avoid any hormonal medication, especially estrogen, progesterone, as well as testosterone, for at least 2 to 3 weeks. Why? Because this medication elicits some clotting formation inside the great vessels of your body, okay? Especially for surgeries that are for body contouring surgeries, as well as for very big surgeries that take a long time. This particular complication is or might be quite common if you don't follow this suggestion. We need also to avoid any food supplements or complements such as vitamin E, omegas, fish oil, curcuma, St. John's wort, and so on. Why? Because these food complements or supplements elicit the contrary reaction to the hormonal medication. They evoke less clotting formation and might make your surgery complicated with heavy bleeding. Okay, that's why we need to avoid these medications or these food supplements or complements for at least 2 to 3 weeks to allow your organisms to clean all these the reactions that these things elicit inside the body. There are another medication that must be suspended from 2 to 3 weeks before your surgery, and one of them is aspirin. Okay, aspirin avoids platelet function. So if we don't have healthy platelets, the bleeding might be heavy during or after your surgical procedure. So that's why I recommend you to avoid it for at least 2 to 3 weeks after your procedure. And the final suggestion, the final general pre-op suggestion that I can share with you right now is to avoid foods with a lot of fat or a lot of irritants. Okay, this is just to avoid any discomfort for you before your surgical procedure. Take into consideration that that honesty is quite important with your surgeon. Remember, you're a new crew member of this new team, and honesty and trust are key elements for you and your new surgeon to have the best possible result and your new you.